Hi, everybody. So we are continuing with the second part of the respiratory system, describing the process of inhalation and exhalation that is better known as ventilation. We're also going to talk about external and internal respiration. So let's talk about inhalation and exhalation. First of all, there is secondary words that are going to describe this process. Inhalation is also known as inspiration, and exhalation known as expiration. Now, before we understand the process of ventilation, we are going to talk about some of the typical physics rules that are essential for your understanding of the nature of inhalation and exhalation. So first one is volume and pressure are inversely related. So what does that mean? So look at the first container. So notice that you have a significant amount of space within that container. So if each of these little circles are air molecules, whatever they are, oxygen, carbon dioxide, nitrogen, doesn't matter. They have a significant amount of space to themselves, and therefore, as you can see on the side, the pressure gauge is pretty low. Now, if I limit the space inside, basically decrease the volume, the molecules are going to be really close together, and that causes the pressure to build up. So when you mention the inverse relationship, it means as volume goes up, pressure decreases, and as volume goes down, pressure increases. Now, the second thing that we want to understand is this. Regardless of where the air is it inside your lung or inside the atmosphere or the air around you, doesn't matter what we're talking about. The focus for us is always the magic number of your pressure, whatever that pressure is. And air always moves from high pressure to low pressure. Easiest way for my students to understand this is think about the concept of diffusion, right? Diffusion was movement of molecule from high concentration to low concentration. Now, here's not the concentration, here's the concept of pressure, but the same concept applies. As an air moves from higher pressure to a lower pressure. Now, the atmospheric pressure, which is basically where we exchange air with during inhalation and exhalation, has a magical number of 760 millimeter of mercury. This is at sea level. This is sea level, which is what we always going to consider as our number. And it doesn't change regardless of if you're doing inhalation and exhalation. So what does that mean? Kind of think about this. If you're sitting in a room or you're outside, you bringing air into your lung or taking air out of your lung has no signal. Well, you are basically as an individual are insignificant in terms of contributing to atmospheric pressure. Okay, that's the easiest way of thinking about it. The only way you can change atmospheric pressure is by going up the elevation or down the elevation. So if people going up the Everest, Mount Everest, they need to carry their own oxygen because the air pressure is really low at high elevations. That's the easiest way again to think about it. But when you are doing inhalation and exhalation, you don't continuously go up the elevation for every breath, right? So, or down elevation for that matter. So this number, the number of 760 for your atmospheric pressure always remains. That does not change. What will change is the pressure inside your lungs as you carry the process of inhalation and exhalation. So let's look at the three numbers, guys. The numbers are 759, 760, and 761. So 760 is when you're basically in between inhaling and exhaling. So you're neither bringing air in nor taking air out. And look at the number, guys. 760, which is equal to what? To your atmospheric pressure. Again, the unit is 760 millimeter of mercury. mmHg is the way that we measure pressure. Now, Look at this number, guys. If you're at 759 and your atmosphere is always 760, which direction will the air move? So if the pressure in your lungs is 759 and the pressure in your atmosphere is always 760, what is the change? What is the direction the air is gonna move? Think about the first question I asked you guys. Air always moves from what? Higher pressure to lower pressure. So atmosphere is 760, your lungs is 759, which means the air is going to move in. So that number is associated with your 715. Oops, well, I don't know what happened. 759. Oh, whoa. My thing is gone crazy. So let me go back. So, sorry guys about that. So 760, I'm gonna write it again. 760 is what? Between inhaling and exhaling. 759 is when you are completing the process of inhalation. Again, because this number is smaller, which means your atmospheric pressure is going to allow the air to move from high to low, bringing air in. So the last number which we have, which is 761, we're saying this is your lungs, right? This is the option for your lungs. So lung is 761, atmosphere is 760. Again, go back to number one in this scenario. Air always moves from higher pressure to lower pressure. So if your lungs is 760 and your atmospheric is your lungs is 761 and your atmospheric is 760, air is gonna move out of your lungs from high to low, and this is associated with your exhalation. So review this again one more time. If you are looking at your 760 for your lungs, that means you're neither inhaling or exhaling, as the pressure inside your lung is equal to the outside. If you are looking at your lungs being 759, that means the air is going to go from the atmosphere, 760, to your lungs, which is 759. That's inhalation. And when you're looking at the 761 pressure for your lungs, that air is going to move out because that's a larger number, and it's going to go to 760, which is your atmospheric. And that's depicting your exhalation. And again, look at the last bulletin point, highlighting the 760. When you're neither inhaling nor exhaling, then the lung pressure is equal to the atmospheric pressure. So let's look at the inhalation process. So inhalation, as I mentioned, is also known as inspiration. What you always start with is the magic number of 760. Now, during the process of inhalation, you involve the diaphragm, which is the dome-shaped muscle underneath your lungs. We mentioned this previously. And intercostal muscles, which are between your ribs. So this means between ribs. These muscles contract. Now again, I'm simplifying here for you. There are technically two types of intercostal muscles, but I don't need you guys to know that detail. Now, both of these scenarios causes the rib cage to expand. And because your ribs are connected to your lungs, if your rib cage is increasing in size, then your lung volume is gonna increase, right? Because you're pulling your lung alongside with your rib cage. If it's not clicking for you what that happens, go back to the previous lecture when we talked about the double membrane of visceral and parietal. And that's the reason anytime your rib cage, anywhere your rib cage goes, your lung also goes with it. So if your rib cage is moving outward, your lung is also moving out, which makes the lung volume to go up. Now, as the lung volume is increasing, right, because you're expanding the lung, the pressure is going to go back. So the pressure in your lung decreases. Remember again, the whole concept here is that volume and pressure are inversely related. This is what we talked about here. Pressure and volume are inversely related. So as the lung expands, the pressure of the lungs go from 760 to 759. So your lung is now 759 and your atmosphere is 760. Air always moves from a higher pressure to a lower pressure, which means air is going to move into your lungs, and that is known as your process of inhalation. Now, when do we end inhalation? Is when you go back to 760 for your lungs. Again, magic number we always try to achieve is 760. Now, what is exhalation? What is happening in exhalation? If you understand inhalation, exhalation is everything in reverse. So exhalation or expiration still starts with the number 760. Your diaphragm and intercostal muscle relax, which causes the rib cage to collapse. Collapse as in moving inward. Rib cage connected to your lungs, so decrease in rib cage causes a decrease in your lung volume, right? It's pushing the lung inward. Your lung is getting smaller, so volume is getting less, which means you are gonna build up pressure. Again, look at the inverse relationship. Volume goes down, pressure goes up. So you were at 760, right? You start with 760. Pressure goes up by one number, so you become 761. Again, same scenario we depicted. Now inside your lung is 761 and outside is 760. So air wants to move from high to low, high to low. So it moves from the lungs outside, which is your atmosphere. Again, that's the exhalation, air coming out of your lungs. And this process ends when you reach the magic number of 760 for your lungs. Do not make it more complicated, guys. Here is the depiction of the inhalation. See, your ribs are small or inward. Rib cage moved out. Lungs got bigger. Diaphragm contraction. Here is when it's relaxed. Here is when it's contracting. So it gets pulled down or it's curved down. And this scenario causes the lung to get bigger and air moves in. As you go from exhalation to inhalation, the lung gets smaller, right? So lung gets smaller, and that causes the pressure to build up and the air leaves your lungs to reach back to that magic number of 760. Now, we have talked about the fact that the respiratory process, there are 3 steps or 3 processes. Ventilation, which is again, as we discussed, is inhalation and exhalation. And then one we identify as external and internal respiration. So what are those 2? So external respiration implies that there is a gas exchange involved. This gas exchange is between your lungs and your blood. And I want you guys to take a minute to think about this. This is from your cardiovascular system. The blood that comes into your lungs, the blood that is coming into your lungs. So here is blood coming from your heart as going to your lungs. So this blood, look at the coloring I'm using, guys. This color is blue, which means the blood is what? Deoxygenated, which means low in O2 and high in CO2. So when it gets to the lungs, what happens to that? What happens to the air? Or what happens to the blood? Blood is going to pick up what? From your lungs, blood picks up O2, and what is it dropping off? It drops off CO2, right? So the blood that is coming out now is going to be oxygenated, right? This blood that is leaving the lung is now oxygenated, which means it is high in oxygen and low in CO2. Where is it destined for? Is again destined for the heart. More specifically, the left atrium. So what is external respiration that I'm depicting? Is this exchange that you see right here. It is when the oxygen moves from the lungs into the blood and CO2 moves from the blood into your lungs. And again, blood going from deoxygenated to oxygenated. Now, before I move on, we already know there is a secondary exchange that happens. The secondary exchange is when you take the oxygenated blood and you send it to your tissue, your organs, or your cells. Now, during that process, what happens is your blood is now going to give its oxygen to the tissues or cells, and it's going to pick up the CO2 from the cells and tissues. So in that scenario, which you identify as internal respiration, is the gas exchange between your tissue and blood. CO2 moves from the body to the blood, and O2 moves from the blood into your body. So depicting this, here is what we have. So blood is coming from the left side of the heart through your blood vessel called the aorta as the main one. Again, look at the color, guys. This is oxygenated blood, which means it's high in O2 and low in CO2. It reaches your lungs, right? Sorry, it reaches your tissue. So here is my tissue, or my cells, or my body. So what is your blood going to do? It's gonna give up its O2. So O2 goes to the tissue, and its tissue going to give it its CO2. So during this exchange, what we're depicting is the exchange is internal respiration, and the blood that is coming out of the tissue is now identified as deoxygenated blood, depicted in blue, which means now high in CO2 and low in O2. And again, it is destined now for the right side of the heart, or more specifically, your right atrium. So the process is you bring in air from outside in, go back, you bring in air from outside into your lungs. Lungs give up the oxygen and pick up the CO2. Now the air inside his lung is not good, quote unquote. So it has high CO2, so you exhale it out, right? Now the good blood that you picked up, and again, good quote unquote implies high in O2, low in CO2, is going to go to your tissue. Oxygen goes to the tissue, and CO2 gets picked up from the tissue. So you go from oxygenated blood to deoxygenated blood. And this whole process repeats that. Here's what we're depicting, guys. Here's your heart at the center, tissues on the bottom, lungs on the top, or your alveoli on the top. We already have named these two systems or circulation. We'll have one on the top, which is going to your lungs. This is called the, if you guys recall, I'm going to give you a second. If it's associated with your lungs, that's called the pulmonary circuit, right? And if it's going to your tissue or systems of your body, this is called the systemic circulation. So look, if you start from the heart, here is the systemic artery, which is the main one, would be aorta. Aorta sends blood by through branching, gives up its oxygen, picks up the CO2. It goes back to your heart. Notice there's two blood vessels here. So it's labeled as systemic vein, but in reality would be your inferior and superior vena cava. That blood goes through your pulmonary arteries to your lungs, and gas exchange happens. You give up the CO2, pick up the O2, and the blood comes back through your pulmonary veins. Kind of remind you guys, there were 4 pulmonary veins, 2 on the right, 2 on the left. Goes back to the heart, and then you repeat this whole process over and over again. Now, we already learned about this when we did the blood lecture previously. Blood is moving through oxygen moves through the blood by connecting to the hemoglobin. So anytime the oxygen is packed inside the hemoglobin, we refer to that as oxyhemoglobin. And when CO2 is being transported, we also learn about this this pathway using CO2 and water, which guys combine together to form H2CO3, which is known as carbonic acid. And then when you release the hydrogen, it becomes bicarbonate. This equation is really important, guys. I do expect you guys to know it, to be able to fill in the gaps. Again, reminder, this is your, why do I care about bicarbonate? This was the main buffering system for your blood. And if you're getting overwhelmed by the equation, just simplify it, guys. CO2 and water. 2 hydrogen, 2 hydrogen. 1 carbon, 1 carbon. 1, 2, and 3 oxygen, 3 oxygen. And then all you need to do is says, okay, instead of saying H2, now I'm gonna only have 1 hydrogen, separate 1 hydrogen. What am I gonna end up with? HCO3, and because that was a positive charge, then your HCO3 will have a negative charge. The only new piece of information you have here is that the enzyme that is allowing this reaction to happen is called carbonic anhydrase, and you do need to know the name. Carbonic anhydrase is the enzyme that allows the reaction to happen, and it's an effective way of us moving carbon dioxide within our body. Moving on, when we talk about your lungs, we have certain volumes associated with the lungs. We have what we identify as tidal volume. Tidal volume, or TV, is the normal amount of air that's being exchanged during normal ventilation. Recall, ventilation basically means inhaling and exhaling. So when you inhale, if you look at it on a graph, inhalation is adding air, exhalation is decreasing air. So if you're looking at a pattern on a graph, moving up means bringing air in, moving down means moving air out. Now, inspiratory reserve volume. Again, inspiratory means inhaling, reserve means as an extra air. So this is the amount of air that you're gonna bring in through the process of deep inhalation. Look at the number, much higher compared to the 500 ml. You're bringing 2,900 milliliters, which is again much larger number. Opposite of inspiratory reserve volume, you have expiratory reserve volume, or ERV. This is the amount of air that you can move after normal breathing through a deep exhalation. So if you do your normal exhalation, but you continue to exhale out of your lungs, that is about 1,400 ml. Now, are these numbers the same for a petite woman that weighs 100 pounds versus a man that weighs 250 pounds? Of course not. But the numbers that I'm giving you is associated with an average male specimen with a total lung volume of about 6,000 milliliters or 6 liters. And again, the numbers depend on age, gender, height, health is a big one. If you're a smoker or you have a chronic disease, these numbers will fluctuate. So here again, look at the picture, guys. I'm inhaling, exhaling, inhaling, exhaling. So this small volume is your tidal volume is about 500. If I'm doing normal inhalation, but then I'm gonna continue to inhaling deeply, that's the inspiratory reserve volume, or IRV. If I did a normal exhalation, right? Normal exhalation, but then I continue to exhale, that would be the expiratory reserve volume, or ERV. Now, regardless of how much forcefully you try to get air out of your lungs, there is always some air that remains in your air passageway, which you can see in green. This area right here is known as the residual volume, as an air that is always gonna reside in your lungs. And that's basically, if you think about it, it's the air that remains, allowing you to float, even if you have deeply exhaled. That's about 1100 milliliters. And vital capacity is a combination of all the air that you can exchange with your environment, which again is ERV, IRV, and TV. Tidal volume, normal inhalation, exhalation, deep inhalation, and deep exhalation. Now, looking briefly at some of the medical conditions we have, tonsillitis is one, which is inflammation of tonsils. It makes the breathing difficult. It's very common in children, and it used to be very common to remove the tonsils through a process called tonsillectomy. However, again, in recent studies, they showed that they do have long-term benefits. So in many cases, they do not complete tonsillectomy in children unless it is causing difficulty or medical challenges for the individual. Laryngitis is another associated medical condition associated with the vocal cord or your larynx. It is typically symptomized by hoarseness and eventually inability to speak or talk. You basically lose your voice. It is a result of infection of the larynx or overworking of the larynx. So the vocal cords are basically overworked. If it is a result of an infection, you can basically treat the infection, and through the treatment, you can resolve the laryngitis. If it is as a result of overuse, basically use it less and you should be fine. A couple other medical conditions you may have heard of, bronchitis and pneumonia. Bronchitis is an inflammation of the primary and secondary bronchi. Kind of think about the air passageway. If these are inflamed, these are results of a viral infection. And in many cases, people may ignore the symptoms and just kind of continue doing what they were doing, working, stress of work, school, whatever they're doing. Body starts to get weakened, which makes you more susceptible to secondary bacterial infection. And again, if bronchitis is not treated, which is typically get plenty of rest, drink a lot of fluid. If it's not treated, then it may lead to pneumonia, which is basically that viral infection that has started with primary and secondary bronchi earlier on in bronchitis is going to expand all the way down to the air passageway into the alveoli or your air sacs, and cause the air passageways and alveoli to be filled with a thick mucus. So again, imagine you have an area where your gas exchange happens between your blood and your lungs, and now that space is filled with a very thick fluid. Gas exchange cannot happen. These individuals will have a significant difficult time breathing, kind of similar to what we're seeing in many patients with coronavirus when they get to extreme cases. They require support in terms of respiratory machines. They do have typically chest pain. Again, if you have built up a fluid, that fluid is going to cause pain. Their common symptoms is also fever. You can see the x-ray of somebody that has pneumonia. You actually literally have a buildup of fluid inside the lung that is visible through x-ray. Another condition that you may have heard of is emphysema. Emphysema is really common in people who are long-time or lifetime smokers, or they have been living in pollutant environment. It is chronic and incurable as it's getting worse by time. The main damage is to the alveoli. Couple of things that happens to the alveoli. One is the elasticity of the alveoli and your lung tissue is removed, which means your lung cannot properly work, and a lot of the air gets trapped inside the lung. And the second thing, as you can see in the picture, here is the healthy alveoli network, lots and lots of surface area. The more surface area you have, the better you can exchange gas between your alveoli and your blood vessels. The scenario you have right here is a person with emphysema. Again, the structure becomes much larger, and that causes a decrease in surface area, which means at this scenario, your blood alveoli gas exchange or your external respiration, external respiration will not be very effective. So these individuals typically rely heavily on oxygen tanks that they need to carry, and they can receive a lung transplant as a measure of treatment. Asthma is another condition. So asthma is a typical person. Here is a normal air passageway. So air passageway is wide open. You have mucus lining, as you can see in yellow, but it's pretty thin. And the muscles around, the smooth muscles around the air passageway, you can see them as is the stripes, are pretty relaxed. So they're not squeezing the air passageway. Now, if somebody has asthma, not an asthma attack, but asthma as a medical condition, typically you have contractions of these muscles. That makes the air passageway a little bit smaller. You have inflammation of your air passageway. So you can see these tissues are reddened, which causes inflammation. And you have a thicker mucus lining sometimes, which overall, these three combined together makes it harder for the individual to breathe. Now, when a person has an asthma attack, what happens is these muscles that are wrapped, these stripes of a smooth muscle that is around the air passageway, are going to contract very strongly. They're gonna tighten around the air passageway. And you already have significant mucus built up in them, and now you have tightened the muscles, so the air passageway becomes really narrow, making it very difficult for these individuals to breathe. A typical symptoms of somebody having an asthma attack is they start to gasp, right? So you can notice they go like, right? They try to bring in air, but that is not accessible. The air is not accessible because here is the air passageway versus somebody that's normal. So if somebody is dealing with asthma, the typical treatment they have for asthma, not an asthma attack again, is anti-inflammatory medication. Basically take medication to limit the inflammation and keep the air passageway open. If you do have an asthma attack, typically what they tell them to use is a fast-acting inhaler. This inhaler, basically what it is, it controls the inflammation partially, but it also stops the muscle spasm. So muscle spasm is basically, again, tightening of these muscles. It allows the muscles to relax and allow the air passageway to open up, and the gasping feeling will go away, typically when you use an inhaler. Now, what triggers an asthma attack is typically what we identify as allergens. It could be different in individuals. It could be pollen, dust, tobacco smoke. Some cases even exercise. Heavy exercise causes the tightening of these muscles. And lastly, we have lung cancer. So again, lung cancer is typically visible in individuals that live in pollutant environment or they are lifetime smokers. It usually starts by thickening of the cell lining in the bronchi. That causes the cilia that lines the air passageway to be destroyed or removed, allowing the dust particle and dirt from the environment to get access to the lungs. This causes abnormalities in the cells that can eventually develop to cancerous cells. The tumor can eventually collapse the lung as a result as they grow. And these cells, these cancerous cells, can also break off from the lung tissue and get access and penetrate other tissues or spread to the rest of the body, which we use the word metastasize. So that's when the cancer basically spreads to the rest of the body. Typical treatment is radiation or chemotherapy and removal of the lung tissue, if it's possible, the cancerous lung tissue from that individual. So you can see in this case, you have a massive growth inside the right lung of that individual. And here is when you compare a lung that is healthy, relatively healthy, versus somebody who is a smoker. Okay, that's about it for our respiratory system. So we will continue with our next PowerPoint on lymphatic system for our next lecture.